Hey y'all. Today I am going to be doing my 20-week update. I am currently 23 weeks. Joshua wants to be joining me. So we're gonna see how this goes. But I am currently 23 weeks pregnant. Okay, I am currently 23 weeks pregnant, but I have not done an update since 12 weeks. So I'm gonna try to update you guys on everything that's been happening to me. So I wanna start off by saying that it has been such a different experience, this second pregnancy. And let me know if you guys have had like completely different experiences as well, because I don't know, it's like you don't have time to think about all of the things and all of the symptoms that you're feeling as much. It's a perfect example. You don't have time to be thinking about all of your symptoms and all of the things that you're feeling because you're chasing around your first. But that being said, we have had some different complications this time that we didn't have last time. My first pregnancy with Joshua. Joshua is 14 months old. He'll be 15 months old in May. So my first pregnancy was like super easy. I mean, of course I had symptoms, but this second time has been a little bit more complicated. So when I went in at one of the appointments, they took blood and my blood results came back like slightly off. So when they test for, I guess, like, y'all could correct me if I'm saying any of this wrong, but when they test for Down syndrome and other genetic abnormalities, they give like ranges to women, and normally if your range comes back 1 out of 270 chance of having a child with Down syndrome, then they don't do any further testing because it's such a small chance. My results came back 1 out of 240. So even though it was still 0.5% chance, they called me. And this happened while I was in Texas at Ben's family reunion that Ben's mom and I planned. So like in the middle of like coordinating, organizing things, it's my birthday and the doctor calls to tell me this news. And at the time I was like, okay, like I just can't talk about it right now because I was in a car with a bunch of people. And then I had like time to process it, and I started like really worrying and stressing and having trouble with it. And so at that point I was like 17 weeks or so, and I had to wait till my 20-week anatomy scan to find out more information. So what happened was, my doctor, he said, I'm not concerned at all, but just simply because the numbers came back not exactly what we like to see, we're gonna go to a high-risk specialist, and they're gonna do an hour-long ultrasound just to really check everything out and make sure that everything is just going as well as it can be and growing as well as it can. And so I think I was like 19 weeks and a few days, and we had the high-risk ultrasound, and it was like a 3-hour process because of some of the different things that we had to do. But long story short, we sat for the ultrasound and she took so many measurements. We spent so much time in there, and that is when we were able to find out that we were having a girl. And so even though that was exciting news, we were still kind of like just like sitting and waiting. Sorry, the lighting is being weird. Is that better? We were just like sitting and waiting and hoping that everything was gonna be the healthiest that it can be. And obviously if that was something that you have to face or that we had to face, then we would deal with it, and we would look at all the possible positives and everything like that. I'm not saying it's a completely terrible thing. I'm just saying when you're concerned about your baby being healthy, you just want the news that they are healthy and everything's going well. So after the ultrasound tech wasn't able to tell us any information. So we had to wait to sit and talk with a different nurse or doctor, and they came and they told us that based on the ultrasound findings, everything looked awesome and completely on track and growing normally. I guess if you are having any kind of child that has any kind of genetic abnormalities, a lot of times some of those like indicators are like the length of the arms or the head or the neck or whatever, like things grow at different rates. And so this doctor came in and she said everything is growing exactly on track. Everything looks completely, you know, I don't want to say the word normal because I don't mean that like babies that have any kind of challenges aren't normal, but everything as far as like growth wise was like on track. And that just based on what she saw, she said now your chances are 1 in like 640, like it doubled the, I know that it's not 640, 680, because it doubled the 240 number. And so she said if you want to take, there's a couple other options. You can have a blood test and they can tell you kind of the same thing, like kind of another percentage chance, but it's more accurate. But it's still not perfectly accurate. Or you can have the your amniotic fluid tested. And we opted out because we felt really good about the ultrasound and we felt like everything was on track, and we didn't really feel, we felt a lot of peace about it and we didn't really feel worried. Anyway, so we didn't go through with any of the other testing. We felt really confident about the health of the baby, and we felt like we had a lot of peace and more understanding about what was going on. And so the other news that doctor told us was that even though like everything looked great with the baby, my placenta at the time at like 19 weeks was lower than they wanted it to be. And she said like 99% of women, their placenta will move up, but because of where it was, I was put on but because of where my placenta was, I was put on pelvic rest until 34 weeks is what she had told me. So like 2 weeks later, I ended up going to the doctor because I had to miss a couple of appointments. We had some stuff come up. So my 20-week appointment with my normal doctor, I was actually 21 weeks. And they told me that not to worry, to just get an ultrasound at my normal doctor at 28 weeks instead of 34 weeks. Or 32 weeks, I don't know, whatever. So at 28 weeks, I'll have another ultrasound or sonogram, I'm not sure. And at that point, I'll also have my glucose test on that same day. So it's gonna be a really fun day. But it'll be good to know how everything goes, because if your placenta continues to stay low, then you have what's called placenta previa, which like the result of that is having a C-section at like 36 weeks. So those are all of the doctor updates that I have, and part of the reason why we hadn't been on here because it took us some time, it took me really some time to deal with the emotion of what we didn't know and what we thought could be a possibility for our life and our baby. And I wasn't ready at that point to share about it and talk about it. And we put our house on the market the week before we left for Texas, the family reunion. And it's been on the market and we've had tons of showings and we have not sold it yet. We are praying and hoping and wishing and dreaming that it will sell really soon. But that is what has transpired with doctor visits. So now I want to update you on my symptoms and the growth of the baby and stuff like that. Okay, so 23 weeks, this is what's been going on. During that month that I was like off, or 6 weeks that I was like off the internet, off social media, basically I was off working out too. I was doing walks. I was trying to get like over 6,000 steps in, but it wasn't super consistent. So a week ago, I started a 21-day challenge with Beachbody. And because I'm pregnant, I'm modifying all of my workouts, and I am not working out every single day. I'm giving myself 30 days to complete the 21-day challenge. So because just with the house on the market and having another baby, like sometimes you miss a day. And so I wanted to give myself a realistic goal. Plus we're gonna be going to Disney, and I wanted to be able to finish this like workout series before I went to Disney and just feel like really good and like I'm putting myself in a really healthy place. And just that makes you feel good about yourself, even if you're not seeing like weight loss results like you would if you were not pregnant. So that being said, I have been doing workouts every morning. They're 30-minute workouts, and I love them so far. Yoga was this morning, and it was actually one of the hardest days, which is kind of weird, but I have been super hungry the last couple days, which has not happened my entire pregnancy. I have been like feeling like constantly hungry, can't get full, all different types of foods. I don't know, that's just what's been going on at this 23-week point. In this pregnancy, I have had so much pelvic pressure, and I think that started around 18 weeks. So just throughout the day, like feeling so much pressure and pushing down and having to like sit down and having to take a break, where with my first pregnancy I didn't feel that as much, but my doctor said it's probably just because this is my second pregnancy. So I don't know if any of you guys have felt like that with your second. The past 2 weeks, but this week especially, I've had really, really bad back pain. It's like kind of started at the middle of the day, and I've had to like sit down or lay down, and it's like just kind of in my low back. And I did have some low back pain with Joshua, but it was more sore, where this is like pain, it hurts. I have started to have some heartburn this week, and with Joshua I had so much heartburn, and I kind of forgot about it because I don't normally have heartburn. And it's back, and it seems like yesterday, like, didn't matter what I was eating. I had like weird heartburn, acid reflux stuff going on. I have felt lots and lots of movement, especially in the last week or 2 weeks. There's been lots of kicking, lots of movements. I started feeling some small movements like earlier on, but now it's like consistently throughout the day I'm feeling her move. According to my app, she is 11.3 inches and 1.10 pounds, or that's what the average baby is at 23 weeks, which it seems huge because it's like we're over halfway. We're getting there. And I did take my measurements today because I looked back on my journal and I found that I had written with Joshua a 23-week update where I had measurements written down. So, everything is very similar. It's almost exactly the same. My thighs are a little bit smaller this time, and my hips are a little bit smaller, but it's very similar, and I kind of thought that that's how this would go. Now, what I hope isn't exactly similar is like all the way at the end, but I'm just gonna continue to try to move and eat healthy and get through it, you know. I mean, you have a baby and then you have lots of awesome time to focus on that afterwards. So I'm trying not to like think about it too much, but I'm also trying to set myself up for the best recovery possible. And that is what has been going on in these past weeks. So if you guys have dealt with any of this kind of stuff, if you've dealt with weird blood results or the placenta issues or anything like that, feel free to ask me any questions on Instagram or through the comments or whatever. I'd love to hear about y'all's experiences and talk to you about mine. But right now, everything is good. We are just trying to get there. So I will probably do an update at like 28 weeks and let you guys know how things are progressing and you know, how things are feeling heading into the 3rd trimester. Thanks so much for watching. Please don't forget to give this video a thumbs up and subscribe to my channel. I'll see you guys soon.